recording is kind of delayed. If you are watching it now, definitely type in questions in the comment section, and Elise, our fancy marketing person over here, will kind of tell me what they are, and then we can talk about them. And then if you're watching it later on too, you can also type in comments, and we can contact you and get going on that. All right, so I am talking about jaw pain today. Kind of the main point of this is to let people know that this is something that you can get physical therapy for. A lot of people don't realize that PT is an option and that it's a really good option. I kind of compare it to if you had knee pain. Okay, so you have knee pain, it's not going away, you're getting concerned about it, you go talk to your doctor, right? So they're going to say some different options. They're going to say, okay, let's talk about the variety. It could be, I'm going to say you have to live with it. They're going to say, oh, take some medication, get an injection, wear a brace. Maybe they'll say just don't do the things that bother you. Or maybe they'll say go have surgery. Or they could also say go get PT, right? So there's a whole slew of options. So the jaw is just like any other joint, like the knee. You're going to go to either your doctor or maybe your dentist too. And they're going to say, oh, okay, well, you could live with it. You could take this medication. You could get this injection. You could wear this guard. You could get surgery. You can go to PT. So just like with any other joint, the jaw just doesn't get referred as often to PT because it's kind of relatively new. But it is a really good option. Obviously, when you go through that list of options, it's like, whoa, an injection, I don't think I need to go that far, and definitely not a surgery, I don't think I need to go that far either. So PT is a really good kind of middle ground conservative treatment. There's not a lot of risk involved, you're not having to go under for anything, you're not having to take a new medication, and most of the time it's super helpful. All right, so today I'm going through a presentation basically on anatomy of the jaw, things that can go wrong with the jaw, ways that PT helps, basically reasons why you would do PT over some of the other options that I just listed. Okay, so a little more about myself. Again, my name is Sonia Anderson. I work here at Cornerstone PT. I'm in our Arden Clinic, which is on Long Shoals Road. I graduated from undergrad with an exercise science degree in 2010, and then I graduated from PT school in 2013. In about 2015, I started getting more interested in the oral facial area, so basically oral facial jaw, fancy word for jaw. And then in 2016, I started working at Cornerstone PT, and that's when I really started seeing more and more of the orofacial patient population, and now it's about 75% of my patient population. A little about Cornerstone PT. We are a locally owned clinic since 2008. We have those three locations. The one in Arden, like I said, is on Long Shoals, one in East Asheville, which is in like the Oakley neighborhood, and then one in Woodfin. We have a lot of subspecialties, orthopedics, of course, pelvic health, which is another really interesting topic that, again, a lot of people don't realize you can get PT for. It's a really awesome, again, kind of middle ground conservative treatment. TMJ and facial pain, what we're talking about today. CrossFit and weightlifting, lymphedema, and then we have a massage therapy crew as well. Okay, so the jaw is a very versatile joint. We definitely take it for granted. We use it day in and day out, and we kind of don't think about it until something goes wrong with it. A little bit on the anatomy. Well, first off, I'll talk about the difference between TMJ and TMD. A lot of people kind of use those and aren't really sure which is which. TMJ is the temporomandibular joint, which is just the name for the joint. We each have one on each side right in front of the ear here. TMD is temporomandibular disorder, so it's basically it's an umbrella term for anything that can go wrong at the joint. So for the actual anatomy, we have the mandible, which is what we think of as the actual jawbone here. And then the temporal bone, which is kind of on the side of the head here. It basically makes up the top of that joint, and then the mandible makes up the bottom of it. We also have a lot of muscles that help make the jaw work. Obviously, these bones wouldn't do anything if we didn't have muscles that act kind of like lever systems and pulley systems. So we've got the masseter, which is kind of like a big muscle right here that closes the jaw. And then the temporalis muscle is kind of in a big fan on the side of the face that also helps to close. The medial and lateral pterygoid muscles are way up, kind of right next to the joint, kind of on the inside of the joint. And they mainly do side-to-side motions. And then the digastric muscles and the hyoid muscles are underneath the jaw, and they help to open. So all of these muscles have to coordinate and work together to do some of the complicated motions we do, like eating and talking. Okay, so the joint dynamics it's a very unique joint. There's no other joint in the body that works this way. So when we first open, there's a roll that happens first and then a slide forward. So in order for that to work, there's a disc between that mandible and the temporal bone, basically the bottom and the top of the joint. That disc moves with it to create and kind of make that roll and then slide forward happen. So common jaw complaints are clicking, popping, catching, locking, limited range of motion, pain, tension, fatigue, and then those can lead to issues with eating, yawning, dental care, talking, singing, sleeping. Less obvious complaints are things like headaches, ear symptoms like ringing in the ears, pain, fullness, tooth pain, difficulty swallowing, numbness and tingling, neck pain, and the bite feeling off. Like the title says, these are less obvious complaints, and that's because a lot of those jaw muscles actually refer to other areas of the head and then cause problems. We'll talk about that in a second here. So that jaw, head, and neck connection, there's kind of three ways that the jaw and the rest of the head and the neck are connected. First, there's the structural or postural connection. That's kind of the first picture with the guy kind of sitting with that forward head posture. We've all done it. It's very unfortunate. We all look terrible doing it. It's something we all need to work on fixing because it causes a lot of problems, including the jaw. The neck is kind of like the base of support for the jaw. So if we're in that forward head posture, a lot of the time, that's changing that jaw position and the way that that jaw moves and interacts. The second way that we've got that connection is by muscle referral. So that top picture with the black X's and the red dots is showing trigger points in their referral. So that muscle they're showing is the SCM right in front of the neck. There's two bands of it right in here. So those black X's are called trigger points. So it's kind of like knots in the muscle. And all those red dots are representing areas that those muscles here refer to. So as you can see, it's all through the side of the face, particularly around the jaw, even up into the forehead, back of the head here, kind of underneath, a little bit into the chest too. So sometimes your jaw pain is actually from your neck, or it could be getting worse because of your neck. Third connection is the neuromuscular system. A lot of these nerves coming out of the neck have similar synapses and attachments. So sometimes what you're feeling in the neck is very similar to the jaw, and it's because there's some crossover there. All right, so then I want to go into kind of some different issues at the jaw, and I kind of put them into subcategories. So the first one is joint issues. So the kind of most commonly thought of issue at the joint is the articular disc. So it's that disc I was talking about earlier that kind of creates some of that roll forward and then slide forward. It helps to make that happen. So usually if there's a problem with that disc, what the patient will experience is some loud popping, a deviation away from midline opening, meaning it's like it's not opening in the middle, maybe it's going off to one side, maybe it's going off to the side and then coming back to the middle. And then also a feeling of the opening being limited, or like a feeling of being stuck. So that's if that articular disc is not tracking properly. You can have hypomobility and hypermobility. So basically hypomobility is reduced mobility and hypermobility is excessive mobility. Again, just like any other joint, you can have those two issues at the jaw. Rheumatoid arthritis can affect the joint, the jaw joint. Surgery, of course, that's something that's an issue with recovery at the joint. When we are healing up for a surgery or from trauma, our body kind of heals tight, and part of that is the joint capsule, and PT is just there to help kind of loosen things up and get it back to where it needs to be. All right, so the other subcategory is muscular issues. This is another kind of representation of those trigger points. So that's the masseter muscle right here with those black dots. So that's where those muscle knots are. And the little red dots are all the areas where the muscle can refer pain to. So basically, if these trigger points in this masseter muscle are bad enough, they're going to start sending signals to other parts of the face. So as you can see, there's a lot kind of along the mandible down here. There's definitely a lot in the ear. There's a few throughout the whole face, and then some kind of above the eye as well. So that's one main muscular issue you can have at the jaw. Overuse and parafunctional activities create a lot of muscular issues. So things like bruxism, clenching or grinding your teeth, bracing your jaw, and non-functional tasks like chewing gum or ice, or like biting your nails or chewing on straws. All of those things are considered parafunctional, meaning you're able to do them, your jaw is designed to do them, but they're outside of what's needed for function, so you're just overusing the muscles. Another muscular issue is loss of coordination. Another is loss of the resting position and proper posture. And a lot of that kind of just develops with that forward head posture, and we kind of, unfortunately, kind of train our body to function in poor patterns. So a lot of PT is retraining, so you're up in that nice position, and this jaw is relearning how to work in a good position versus trying to adapt to a poor posture. The last issue is nerve issues. Neuralgia is nerve pain due to an irritated or damaged nerve. So really it can happen in any nerve throughout the body, kind of depending on what's going on, whether it's, just idiopathic, not really sure what the cause is, or maybe it's related to a trauma, or maybe it's even something as simple as swelling. The most common for the face and for the jaw is trigeminal neuralgia. So down below, I've got a picture of the trigeminal nerve. You can see it has a big nucleus right there, and then it splits into 3 different sections. So there's a section that goes above the eye, a section that kind of goes through the cheek, and a section that goes down along the mandible. So you can imagine if there's irritation or damage in any of these parts, you're going to get some pain for sure. The nerve also supplies sensation to the face and then motor control for chewing. So besides just pain, you're probably going to feel a little off with your coordination. Irritation or damage can cause severe facial pain, even with low stimulation. Also experience changes in chewing coordination. Okay, this is a little less common, but it happens. So let's talk about what you can do about your pain. Kind of goes back to what I talked about when we're comparing with the knee, about how you can just kind of ignore it or change what you're doing. So with the jaw, kind of your easiest option would be to ignore your pain. So in order to ignore your pain, you'd have to do things like modify your diet. Let's say you're only going to be able to eat mashed potatoes and smoothies and applesauce. Another way to ignore it would be to limit dental care. A little scary if you're doing that for a long period of time. Limiting socialization, that even happens if people feel like they're getting a lot of pain talking for long periods of time. Okay. Another option is to alter or mask your pain. So something like getting injections, pain medications, ice and heat, using a TENS unit. Those things can help short term, but they're not going to change the underlying problem. So then really the best thing to address your pain is to change it, right? So physical therapy is the best option for many patients with jaw pain. Like I said, it's kind of that middle ground, conservative type option. Can help to avoid surgery for sure. There's definitely a lower cost. There's minimal side effects. There's a specialized treatment plan. Each patient gets basically their own, depending on their presentation and what kinds of things are going on. Self-management and maintenance is really the end goal with PT, and it's also an evidence-based program. So a lot of people don't really know what is included in PT for the jaw, because most of the time nobody really even realizes that this is an option. So just like with any other joint, there's an individualized assessment with this evidence-based program. That would include us talking about what are the most important parts of your life that you're having difficulty with because of the jaw pain. How's sleep going? How's eating going? Obviously, the answers to that are going to be different for every single patient who comes through. So then there's a hands-on treatment, also hands-on for the examination as well. So we're going to assess and then work on joint mobilization, so moving the actual joint, just like you would do with any other joint, working on the soft tissue around it, and possibly some dry needling depending on what is actually needed for those muscles. And then of course exercise. Again, a weird thing to think about with the jaw, that you're exercising your jaw. But exercises are really important for recovery and for that management maintenance, which is really where we want to get to after we're done with PT. So exercises work on mobility, strength, coordination, regaining that proper resting position, habitual reversal of parafunctional activities. So that'd be like getting rid of some of the gum chewing, clenching your teeth, grinding, and also just working on your postural stability. Again, posture. We'll do an assessment in sitting, standing, what your normal work setup is, what your typical driving setup is. That all plays a really big part because we are in these positions for a long period of time. Since we're talking about it, we can kind of look at this really quick. So we've got sitting and standing. When you are sitting, the hips and knees should be at about a 90-degree angle, so you can see the person's torso and the top of their leg are at a 90-degree angle, and then top of their leg and bottom of the leg at a 90-degree angle. Arms should be rested pretty good on the table, again with that about a 90-degree angle at the elbow, as you see there. You should be about 30 inches away from the screen, with the screen a little tilted back, and the top of your, or the top of your screen should be about at eye level. Same thing when you're standing up, top of the screen about at eye level, elbows at that 90-degree angle, able to rest it on that keyboard or on the desk, and then, nice tall posture through the torso. I would definitely recommend anybody who's having issues with a desk setup, either at home or at work, to look into some type of a standing setup. so that they can vary the position. A lot of the time, it's not necessarily the position, it's just the fact that you've been in one position for too long. I would also say you should try to change the position, or at least get up and take a break from the position about every half hour, really. Sleeping position is super important. Obviously, this person is sleeping terribly. She probably has a lot of jaw pain and probably headaches. Sleeping on your stomach is the worst position for the jaw. Your head's turned to the side, so it's already pretty rough on the neck, right? Also, when you're in that position, all that pressure is going right on your jaw. So your response while you're sleeping, your response to that pressure on your face is going to be to clench your teeth. So a lot of the times, people that have a problem with clenching and grinding at nighttime just need to change their sleeping position. Also, if you're on your side and you have your hands up at your face, that's the same effect. So proper position, either on your side or on your back, whatever you can do to get into a neutral spine position. So your head shouldn't be too far down, shouldn't be too far up, shouldn't be too far back, shouldn't be propped up too high. The jaw should be in a nice neutral position. You shouldn't have to feel like you have to push your jaw to keep it closed, or sleep so that your jaw is open, or sleep with your hand cradling your jaw. Those are all going to cause more problems. Arms should also be in a neutral position. None of that like arms above the head, or tucked under like this. Usually down in front of you, or maybe like hugging a pillow is the best position for your arms. Resting position for the jaw is super important. The position is your tongue up on the roof of your mouth, not pushing into your teeth at all. So kind of like you're saying the word no, that n part of it. So that's the tongue up. Teeth should always be apart. We have no reason for our teeth to be touching. And lips should be closed. With that nice tall, or that nice resting position of the jaw, you should also be nice and tall through the spine, neck in a neutral position. So the goal of physical therapy is to get your symptoms reduced or abolished, with the patient, you, independent with management, maintenance, and prevention. So basically, I want to get you to the point where you say, wow, I really feel good. I really am not concerned about my jaw anymore. And if for some reason in the future I have an issue, I now know how to manage it and know how to prevent it and know the exercises to get rid of it. So we currently have 3 options to change your pain. You can come into the clinic for an evaluation. We are open and we're deemed essential services by the Department of Homeland Security. We're also cleaning everything. We already were, of course, since we're a healthcare facility, but we've really stepped that up a lot. Everybody's far apart. Everybody's wearing a mask. You can also schedule a telehealth evaluation and follow-up treatments. Not all insurances will pay for this, so please call the clinic if you are interested in that, and we can check out your insurance benefits. You could also just start with the advice and tips we discussed in this presentation, and come at home once we don't have the stay-at-home order anymore, but you can come in once you feel more comfortable, if you're kind of feeling like you want to stay at home right now, and that's fine. Leave your email in the comments below, or send to Elise at cornerstoneptnc.com. And then definitely, if you have any questions, either type them in now or later on. Elise can contact you and follow up with any questions. I don't think we have any now. All right. Thank you, everyone, for tuning in. Definitely check out more on our Facebook page. We've done a lot of other presentations on a lot of other really good topics, and we will see you next time.